Welcome back to another episode of Behind the Counter. On this season, we are talking about a lot of stuff related to sex health and libido and hormones and all that kind of stuff. We're talking about things that affect your libido negatively, right?
Sure.
So now, today, we're going to talk about the opposite. What affects it positively from a medication perspective, specifically. Right. And that is where our dear pharmacist friend, James, comes in handy.
That's not... the medications are not to increase libido per se.
Right.
But is to make certain things work.
Performance.
Or perform when it's needed, you know?
Right.
It's really interesting whenever I get a prescription, right? And a customer comes in, they get 10 prescriptions, right? And for some reason, this is too expensive. $10, too much. $20 too much, and the pill, $50. I would just take this off for the day. It happens quite often.
Yeah, it does.
And number of times I just want to run out there. It's like, are you really sure you want to spend your $50 there?
Versus your blood pressure.
Versus, yes, the one that actually may save your life.
You know what's funny too? I think you see such diverse reactions, I guess is the word I'll use, from people as well. There are the people who are extremely sensitive about it, and understandably so. You know, it's a sensitive thing that you don't necessarily want to share people to know. Sometimes even keeping it from your own partner, right?
Absolutely,
I've seen that too. But
of course. Then
on the flip side, you have the people who, when you bring them up at the register, they go to give you a high five as they're leaving, right?
One of my favorite is, well, does this work better than this one? And I'm like, well, I haven't tried it either of them, so can't really tell you from personal experience, but you know. So I do get the question quite a bit.
Well, that's a good question. How do they work from a performance perspective, and do they work differently? Because there's a couple different types of pills you can take, right?
Yes. Some of the brand names that many people be friendly with Viagra, Levitra, there is Cialis, and there is Astendra, I believe. They all basically work very similar way. Okay. If I break it down into the mechanism of action of how these work, the whole idea is to basically increase the blood flow when it's needed, so it helps with it helps with erection. I mean, the whole terminology of erectile dysfunction was booming 19 years ago when Viagra first came out.
Sure.
And ever since then, Pfizer did extremely well. Pfizer was the company who made Viagra, was certainly a hit, and a lot of, on the flip side, also led to many counterfeit medications. I think around the world, I still believe the Viagra
got a lot of attention, if you will.
I think the Viagra is still the number one counterfeit drug probably in the entire world. Yeah, I mean, it's blue pill, the blue pill. So. Which led to a lot of concerns because there's a lot of possible drug interaction with these. There are things to be really concerned for, you know. So I just would like to go over a little bit medication-wise. Are there really difference between one or the other? Yeah. The number one, Viagra, right? It's pretty interesting how Viagra actually came about. I believe in UK they were studying the ingredient, I guess, or the chemical in order to help with blood pressure. And they were studying this product, you know, doing clinical trials. And you know what? It really wasn't doing anything well for that specific purpose, what they're studying for. And I believe, from what I heard, is that they were studying by the Wales area in UK, and they were giving these out to the minors. And
really?
And yeah, and some of them said, actually, well, you know, I definitely seen pretty good effect when it comes to the performance, right? That's when Pfizer decides to, you know what, we might have something here, and they went to that route, and boom,
there you go.
There's a Viagra. Now, the generic name or the chemical name is sildenafil. They still use it for possibly for pulmonary hypertension or pulmonary blood pressure, higher blood pressure. So it can be still used for that purpose, but this one, what happened was basically it wasn't what they intended for, but they found Eureka, they found the gold mine.
Eureka, right.
They found the gold mine. So that's how they come about. Now it's finally generic after about 19 years. So the prices are certainly going down. At one point, it was extremely pricey.
It was insane. $400 for an entire fill, right? But per pill, it was
almost $50 depending on where you go. You know, that's why all the counterfeit drugs are popping in and say, well, you know, the same thing at a fraction of the cost. You know, however, now it's finally generic and prices are finally going down. So hopefully, it's a little bit more accessible. Major interaction. I'm going to start off with this because I really believe this is extremely important. A lot of customers that I've seen personally at getting these medications are fairly elderly and on a lot of different blood pressure medications.
Right.
I know Sheldon probably go over a couple of those later.
Sure.
But it's more about there is a specific product called nitrates, whether it's Imdur, that's a brand name for one, or just nitroglycerin, or some people takes for angina attack. It definitely has a huge interaction up to the point that it can even be fatal. However, it's sometimes really difficult to tell, or because one, they're just embarrassed to talk about it, the customers. Number two, because the price was so expensive, they were getting from their friends, or whoever, one of their family relative. Well, this was covered by my insurance. I got 30 pills. Let me share them out. And not realizing that how devastating effect that it can have, especially with nitrate. I said possibly drug interaction with antibiotics.
Wow, antibiotics.
Yeah, absolutely, because they get metabolized by the liver.
Sure.
And there's some enzymes that fights for that medication to metabolize it, and then it can cause a lot of different issues. But it's that pill that's kind of under the water. Not many people want to talk about it, that they're on it.
Right.
I definitely see it doing when I was an extern at a hospital.
Would people even deny that they were on it, even if they were?
Some, yeah.
Because that I would imagine, cause some safety issues if someone is trying to help you. Okay, you're not taking this. I mean, maybe that one may not be as dangerous in general, but medication not being transparent with your physician is just never a good thing. Right?
Well, sure. However, let's just say if you are in a hospital bed, right? Your wife, your children are right next to you. And
sure.
when some of these sensitive questions are given, it might be a little difficult to answer, Or
sure.
even, they might be, it's none of your business, what do you care for? I'm not here for that condition anyway.
Right.
So, you'll be surprised how many people will be withdrawing those information, or even, they don't even realize the fact that they took that pill. Why? Because sometimes they're given by their friends here. I took this, and it really, saved that day, and here, give it a try. They don't even realize what they're taking is specifically whether Viagra, Cialis, or any of that stuff. So it's pretty common, unfortunately, the way I see it, that they will not be talking about it.
Right, it's a sensitive topic.
Yeah.
Speaking of hospitals, I've always wondered, what's the deal with that 4-hour warning?
Yes, it's called basically unhealthy, or any men really, generally gets an erection with sexual stimulation, right? And generally, when everything is said and done, it goes back to its normal state.
Right.
Unfortunately, it's called priapism.
It's a condition, priapism.
Correct. It's still erect after, it stays erect for about 4 hours. I should take my hands out, right? It stays erect for at least 4 hours, then it's definitely a medical emergency. You have to be seen by a doctor. There are two possible reasons for it. Ischemic, non-ischemic, but not really going to get into that. Basically, it has something to do with the blood flow of it, that it just won't come back to its normal state.
Right.
So it definitely requires an intervention that you should rush to the hospital.
You see jokes about it on TV
and
that kind of stuff all the time, but is that caused by any specific interaction, or is it just this happens sometimes kind of thing?
It can be purely as a side effect of the medication.
Gotcha.
So it's pretty rare, but I actually think I saw it once when I was in hospital rotation. I've seen a customer coming with that. Yeah, I was like, wow. Listen.
You were like, wow, nice.
Wow. Where's this patient? I want to talk to him, So it is, people do joke about it, but it is an extremely serious condition. It has to be addressed right away.
Gotcha.
Now, other medications, Cialis, or now commonly called the weekend pill, It's called that way because it has a little longer lasting effect compared to Viagra, or so they claim. Levitra, they claim that it has a possible less side effect with other medications. What else? Stendra. Stendra was, how they were promoting Stendra was that, well, listen, you can have a couple glasses of alcohol, and then I'm pretty sure that's how they did it. Or with meal, after meal, large meal, you can still use it, because I believe one of the things with the Viagra is that if you have a high fat meal, it may reduce the efficacy of the product.
Interesting.
So, there are many different pills out there.
Get the chicken, not the lamb. Got it.
So it's pretty interesting how they're all going, and certainly a great success, right? For the pharmaceutical industry.
Sure.
And people who needs it, hey, it worked pretty quickly. I think generally in about 30 minutes to an hour. But then that can even be a little difficult.
Sure.
When you don't know when sometimes you don't really plan it.
Right.
It happens, right?
You see those commercials, when the mood strikes.
Right, when the mood strikes. So
or don't miss the moment or something like that.
Right.
I see on those commercials. Isn't there a female Viagra as well or something?
There is a new one called Addy. It works differently. Now, all the product that we just talked about for male is simple blood flow increase, right? We pretty dumbed it down a lot with that by saying that, but the mechanism of action is unknown. How that works, and you'd be surprised. A lot of medications actually say that mechanism of action is still known, but it kind of works. Right?
Interesting.
We believe that it works with serotonin in the brain, rather, so that it helps with their overall mental mood. That's the guess. I'm guessing here with that. But they do claim that it definitely, about 50% of the population really seen some improvement with it. They do take it on a daily basis, and within 12 weeks, people seen effect. So
So that's something that's not like a, one-time window of opportunity kind of thing. That's like a consistent.
Right. And I haven't seen a prescription for this yet.
Okay.
And I haven't actually seen a pill for it yet, but it is definitely out there because, as you just saw, there are many medications for men, but not much for women. But listen, it goes both ways. Sex life and libido is extremely important for both genders.
Sure.
Sometimes I feel it's really difficult to talk to, because I'm a male pharmacist. Sometimes it's difficult to talk to a female customers when it comes to some of these issues.
Or they're not as comfortable approaching you.
They won't come talk to me about it because if they have some of these issues, or they usually don't have a problem talking about their husband's issues, but they have a pretty big problem talking about their own issues.
Sure.
But there are certainly medications that can be compounded. I'm sure Dr. Boyle goes through it quite in depth with this with this topic. There are creams that can be used, or just general hormone replacement therapy will be a possible usage for it. And as we said, medications like there's new female Viagra for it as well. So it definitely needs to be addressed more appropriately. Sometimes I feel like, other than just aging, I notice in some of those female customers, it's just I might be hitting menopause.
Right.
And that's just because you may going towards that route doesn't necessarily mean that you have to give up your sex life.
Right. No, for sure. For male patients, they may be hitting menopause and maybe just need to go buy a car or something.
I mean, it might be many, many different things, but I feel like men are a lot, it's easier for them to, maybe not easy, but they are more forward in talking about it and asking questions about it, versus for some ladies, it's really not the case.
Yeah.
But, the reason that these medications are made is because there's a need for it.
Sure.
So it's extremely important that you talk to your healthcare professionals. And the major takeaway point is it does have a lot of different drug interaction.
Right.
Potentially fatal. So, don't hide that.
Yeah.
And don't get it from next door neighbor. The price has gone down a lot. So it's really important that you ask the questions.
Make sure if you're doing it, you're doing it safely.
Yeah, absolutely. There are some other compounding options as well. Some of these ingredients can be used, we like to call it troche.
Sure.
It's like a little jelly-looking thing that you can stick it inside your mouth. and then it melts, so
Right.
it gets absorbed buccally. So it might help with the shorter duration of action. Hey, as a mood strikes, you feel like, okay, it might be the right time for it after dinner. It doesn't look like a pill, so you don't need a water for it. So to swallow,
subtle is what you're saying.
Right.
More subtle.
It's a lot more subtle when you
Yeah.
use it as a buccally. So there are many different options. So definitely ask us about it and ask your doctors about it.
Cool. Sounds good. Well, thank you all. If you have any questions, as always, feel free to comment on our page or check out our websites at hbpharmacy.com or gasparsbest.com. And we will see you guys on the next episode. Thanks.
So hormones are just messengers. So just like the oil was the messenger and changed things, hormones are just messengers. They're messengers that are created by your glands, like the thyroid gland in your neck, or if you're female, your ovary, or if you're male, your testes. And so they're messengers to go through the bloodstream to the certain organs to keep them strong.